Thank you.
Thank you, sir.
Now we have come to the end of the session. Thank you all. And I would like to thank again. Sorry.
You have?
Sorry, that is Dr. NEHA MARIAM George, paper number 09.
Good afternoon. My study compares tear film breakup time and Meibograde in patients using long-term anti-glaucoma medication. My aim is to find the relationship between tear film breakup time and Meibograde among patients using long-term topical anti-glaucoma medications and to determine the effect of long-term topical anti-glaucoma medication on meibomian gland morphology and tear film as evidenced by Meibograde and TBUT. Introduction. The active agents and preservatives in the anti-glaucoma medications are found to be decreasing goblet cells and tear secretion. However, the direct and indirect effect of them on meibomian glands are being studied, and it shows that there is a significant association between meibomian gland dropout and long-term anti-glaucoma medication use. Materials and method. I did a cross-sectional study with sample size of 50 patients and non-probability sampling technique was used. Inclusion criteria. Patients who are diagnosed with glaucoma and have been using topical anti-glaucoma medications for more than 6 months period were taken, and patients excluded were those using tear film substitutes and already on meibomian gland disease treatment were excluded. Data collection started after ethics committee approval. Written informed consent was taken from each patient and patient's biodata noted. Slit lamp examination of anterior segment done, and dry eye was quantified with tear film breakup test, and meibomian gland was examined with infrared camera of the autorefractometer. Now Meibograde was graded according to this photograph, where grade 0 means 0 to 25% loss of meibomian glands, 26 to 50% loss was graded as grade 1, and grade 2 was 50 to 75% loss, and grade 3 was more than 75% loss. Statistical analysis done using SPSS software version 24 and chi-square test was used. P-value less than 0.05 was considered statistically significant. Coming to the results, 98 eyes of 50 patients were studied. Out of that, 51% of them were males. Now, most common, 53.1% patients were using 3 to 4 drops per day, and 38.8% of the patients were using anti-glaucoma medications for 1 to 3 years. 36.7% of the eyes had a tear breakup time less than 5 seconds, and 18.4% had Meibograde 3. Now, this is a table showing association between tear breakup time and Meibograde. Among the eyes having Meibograde 3, 55.6% had a tear breakup time less than 5 seconds. In patients with tear breakup time less than 5 seconds, 38.9% were using medications for 1 to 3 years. In patients with a tear breakup time less than 5 seconds, 55.6% of them were using 3 to 4 drops per day. Meibograde 3, 44.4% of patients with Meibograde 3 were using medications for 1 to 3 years, and 77.8% with Meibograde 3 were using 3 to 4 drops per day. Coming to the discussion, a study by O et al. Studied 103 eyes of primary open angle glaucoma patients on anti-glaucoma medications for more than 6 months, and 83.5% of the patients were found to have ocular surface disease according to tear breakup time. In my study also, 87.7% were having a dry eye according to the tear breakup time values. A study by Uzun Osmanulu, 70 patients on anti-glaucoma medications were studied who were on medication for more than 1 year, and MGD was detected in 80% of the patients. In my study, 87.8% of the patients were having meibomian gland dropout. In a study by Tabaki et al., 88 eyes of PUAG patients were studied for Meibo score and non-invasive TBUT. And there were both monotherapy and multiple drug use affects the parameters of meibomian gland morphology, and similar results were noted in my study also. Limitations: it was a small sample size and had a cross-sectional study design. There was uneven distribution of study subjects among the different study variables, and there was non-uniformity among patients, as some of them were on monotherapy and some were using a combination of anti-glaucoma medication. This also affects the number of drops used. Conclusion: the significant meibomian gland dropout and tear film dysfunction occurs in patients on long-term anti-glaucoma medication, as evidenced by tear breakup time and Meibograde. The tear film dysfunction and meibomian gland dropout worsens with increase in duration and dosage of treatment. These are my references. Thank you.
Thank you, ma. Thank you so much.